It's time to get to your calls. We have questions for Dr. Zorba Pastor. He's in his office in Oregon, and we'll start with Mark in Beloit. Hello, Mark. What's your question? Mark, you there? He's not there.
In the years to come.
He's wondering if there are more viruses to be expected in the future.
Of course. There always are more viruses. We had SARS, we had MERS, and now we have COVID-19, and there'll always be viruses in the future. We will never get away from viruses. And every year we have seasonal flu, and our hope is that COVID is like seasonal flu and that it'll just go away. And that's what happened with SARS and MERS. They just kind of disappeared. So who knows? Uncharted territory, for sure.
It definitely is. All right, let's go to Cheryl in South Beloit. Hi, Cheryl. What's your question?
Yeah, hi. I have a senior bus trip planned to New Orleans in a couple of weeks, and I am 75 with COPD, and now I'm a little worried about whether I should cancel it or not, or wear a mask, or what should I be doing what do you think would be good advice for me?
I definitely would not cancel it at this point. If you're going to have a senior bus trip with a bunch of kids from Wisconsin going down there right now to New Orleans, I would say go for it. Go to Mardi Gras. Have a wonderful time. But I wouldn't cancel it. And what you're going to make that decision a week or two before. You'll see what's happening. There might be a lot of COVID in Wisconsin or in New Orleans, and there might not be any at all. But right now, I would do it. I would suggest you do too.
All right. Let's go to Darlene in Lake Dalton. Hi, Darlene.
Hi there. I was wondering if you would get the virus, how long does it last?
Well, this is the interesting thing. So the article in The Lancet for looking at people in the hospital in Woburn, it turned out we thought the virus lasted viral shedding for about 2 weeks. And remember, the virus starts occurring before you really have any symptoms. So in other words, you're infectious before you even know you're infectious. But it doesn't seem to last for 2 weeks in hospitalized patients. In these patients, it lasted for 3 weeks. And that's a bit scary because we're doing 2-week quarantine. So the recommendation in The Lancet was anyone who's been quarantined and tested positive, you've got to make sure that they test negative before you actually release them. But it's somewhere in that right now. We think it's 2 to 3 weeks, but frankly, it's new science, so it's really up in the air. You want to stay informed.
Okay, let's go to Karen. Sorry about that. Hi, Karen. What's your question?
Okay. People or workers in restaurants, especially cooks, should they be wearing a mask?
No, masks really don't do anything at all. They don't do anything, not one thing at all. They really, because you blow out around the side of the mask, and if you're going to actually infect somebody, but it's really direct contact. It's not that it gets in the food. It's direct contact with roughly 6 feet away. That's how it can be spread. Does not stay in the air longer than that. Now, if you look at the contagiousness of measles, remember, we have a measles epidemic in certain parts of this country right now. Measles can travel 100 feet, that's 30 yards, and the measles virus can stay in the room for 2 to 4 hours after somebody leaves the room, and the contagiousness rate is 99%. So measles is far more contagious, for example, than COVID. COVID is not as contagious as measles. Masks aren't going to do anything. It's just a matter of keeping your hands clean like everybody else.
All right, let's go to Marvin now in Madison. Hi, Marvin.
Hey, how you doing?
Good. How are you?
Could be worse. I'm just a little worried about this virus going around, you know. I've been through 2 lung cancer surgeries, but I work part-time every day. I'm not around that many people at work, but sometimes I do a little driving on the side for the company, and so I'm out and about all across the state, and mingling with different people with my deliveries. So my question is, should I just stop doing it and wait until they get this thing under control, or what?
I don't think at this point you need to worry. Now, a week from now, I might say something different. Now, if you were in Washington State and you were driving around Seattle where there's a hot spot, I would say you have to think twice about that. You've got to wash your hands. You've got to think about whether or not you want to take a risk. But right now in Wisconsin, we don't seem to have it. What's going to happen a week from now? I'm not sure. But I would say at this point, keep your hands clean. That's the main way that really keep from doing it, and stay away from people who are sick. So you just have to be aware of it.
I think it's the
now,
uncertainty.
do you want a hand pump or fist bump? That becomes a different issue. You want to keep your hands as clean as possible.
Yeah, I think it's the uncertainty that has spooked a lot of people.
It's a fluid situation,
right.
Yeah.
All right, we are out of time. Thanks for everyone for calling in. Zorba, thank you for your time.
Thank you, Zorba. Great to see you.
My pleasure.
We'll have a final check of your forecast coming up.